think the part, though, that is a little less appreciated is how ineffective we are at supporting people with mental health. 60% of cases go undetected, undiagnosed, untreated. And there's minimal screening for early detection, a 10-year lag between disease onset and diagnosis. And it's because the system wasn't designed to support mental health effectively. If you go to the next slide, what has been the outcome? In every other area, we're doing much better. Cancer's down, stroke is down, heart disease is down, suicide is up. And it's because the system, it isn't because society is suddenly becoming less attuned to the issue of mental health. In fact, all the cultural elements around mental health are getting better. People are much more accepting. Stigma is actually being reduced. There's a lot of momentum building on the societal, cultural elements. The system is getting worse, and that's part of the problem. Next slide. So this group came together about 1.5 years ago to collaborate on what we described as the path forward for mental health and substance use. And the idea was to look at the evidence-based issues that are getting in the way of people getting diagnosed early and treated effectively for mental health and substance use disorder. Next slide. So what are those 4 pillars that we're focusing on? The first is network access. This seems like it would be a given, particularly through employers. We provide insurance, there's mental health parity. Doesn't everybody have equal access to mental health services as they do for everything else? The answer is an absolute no. Try to get an appointment through your network, and it doesn't work. It doesn't work effectively. It could be a 6 to 8 week. There are stories of people calling people in the network listed in the book and not getting a phone call returned from 8, 10 different providers. They're kind of the phantom networks. And this is a key issue because much of the care is being delivered out of network. And if you want to talk about equity, if the care is delivered out of network, you're paying out of pocket for the deductible, the co-insurance, and frankly, very few Americans can afford to pay for this care out of network. The second issue is collaborative care, which is integrating primary care integrating mental health and behavioral health into primary care. And there's an evidence-based model, the collaborative care model, that has 70 random controlled trials that delivers outcomes and is reimbursed under Medicare and under most medical plans, but it's not common practice in the United States. And there's a change effort that has to be mobilized and frankly needs funding at the federal level to get mobilized so that we do diagnose early in primary care and that we practice evidence-based care in primary care for mental health, where most people seek services for their mental health. Measurement-based care is the idea of measuring early to early diagnosed, but also measuring as care is delivered so that treatment patterns are improved during the course of care. And the evidence shows that if you use disciplined measurement-based care in mental health, you improve outcomes 20 to 60%. And obviously, tele-behavioral health is one of the bright spots that has emerged during COVID-19. It's exploded, but the policy issues to sustain the gains that we've made with tele-behavioral health could not be more important or more critical than they are right now. Many of the gains will get reversed if the policies revert to being more restrictive on permitting tele-behavioral health going forward. Next slide. But the basic point of this is it does deal with these issues around stigma and the fact that people can't get access, promotes 100% screening, trains primary care to effectively treat. It boosts access to in-network specialists, and it promotes improved access in rural communities and inner cities through tele-behavioral health. Next slide. And the net gain on that, will we spend more on behavioral health? Absolutely. And we need to. But will that have a return? We represent the purchaser, the plan sponsor community. If we early diagnose, it will be less expensive later on. If we treat it, it has a mitigating impact on other conditions for men and everyone else. And so we need to be responsive to these behavioral health priorities to move this agenda forward.